time here today. My name is Melba Heck, and I am at present a very satisfied customer of Medicare. You're looking at an 82-year-old retired emergency room nurse who is physically wearing out. And Medicare made it possible for me to be rebuilt. I am walking and raising 2 artificial knees without any pain, and I can raise both arms up over my head. I had rotator cuff surgery to put my arms back, and without this surgery, I'm sure my arms would be hanging down like an old Irish step dancer. I'd probably be walking about with 2 canes if the arms could hold them, or maybe even on a wheelchair. Then to keep all these things supplied with blood and moving, I had to have a stent put in my heart to clear out a 99% blockage in one of the main arteries, and thank God I'm doing fine ever since. I know this sounds like one of those old unsolicited testimonials we used to hear, but these are just some of the reasons I have supported and worked with this committee to promote health care or Medicare for All and the HR 676 single payer bill. Without Medicare, I could not have afforded all these surgeries, and by putting them off, the quality of my life would have been severely changed. I'm going to have to raise it up. The eyes are failing away. And I'll have to get a Medicare glasses. You know, you will probably all remember the Macarena dance we used to do. You touch your head, you touch your shoulder, touch your hip, you touch this and that. Well, every time I was going to the doctor's office and they'd say, here's a form, fill out this form, and it would have, list all your surgeries and date of surgery and stuff. I said, I can't keep remembering all these things, so I made my own little Macarena dance. I started out with ages 72, 73, 74, 75, 78. That way I can remember each time I go to the doctor what I had done and where I had it done. So that's my little routine. Hopefully I will not have to add any further moves to that routine. Medicare also provides preventive care by enabling and encouraging users to get the physical exams and any tests that might detect hidden conditions before they advance in severity. You know, you don't have to be 80 to have health problems. And unfortunately, this is one of the reasons we all need health care coverage from the cradle to the grave. Medicare or health care for all would cover everyone, but the entire population enrolled under one plan. You would have the broadest base possible to finance the plan. This will also eliminate the vast control of the for-profit healthcare companies, which have over the past decades raised severely the cost to the consumer and delivered less and less care for your money. The plan would also help control the cost of medicines and drugs by negotiating with the drug companies, like the VA does and has done for years. Presently, these large, very profitable healthcare and drug entities severely influence our elected officials with cash, junkets, and other favors, even allowing them to help write our healthcare laws, like they did when they passed the Medicare Part D with its infamous donut hole. I have fallen into that hole every year since its passage, and it has cost me thousands of dollars out of my pocket, as I am sure that many of you and millions of other Americans have been affected annually. Our House and Senate should have had the courage to pass health care for all instead of this present plan, which, as you know, is in the hands of the Supreme Court right now, and we will not know until June what we have, if anything. But remember, the Congress and the court will still have their excellent free health care plans paid for by us, the taxpayers. So be alert, learn all you can, since none of us knows what tomorrow will be health-wise. And also think of your fellow man's coverage. As an emergency room nurse, I know that we treated everyone, but someone had to pay for this care. And if they couldn't, your taxpayers did. This is another reason it is so important to have a broad-based plan with everyone participating. I'll close by saying Medicare has served me well, and I am very appreciative. I want all my fellow Americans to have the same type of coverage. That is why I'm supporting the Healthcare for All. Remember, be informed. Know who and what you're voting for in November, because the rest of your life may depend on it. I want to thank you for coming here today, and I wish you all good health in the future.